Serving the underserved. For more than 35 years, a local black-owned marketing agency has worked to improve both social and health disparities across the country. MEE Productions has worked with some of the best and brightest professors, psychologists, and authors. Action News photojournalist Tim Matter spoke with the agency's founder about mastering life's journey.
I'm Ivan Juzang. I am the founder and president of MEE Productions. We're a health communications firm that I started back in 1990-91.
We've been able to work across the globe and internationally as well, actually giving back to the community. Those experiences can't be replicated. We think that what we do has a significant impact in how the community develops and moves forward.
Yeah, and I've had the opportunity to work with some of the most amazing thought leaders. As we're in Black History Month, they would use the term African deep thought. Dr. White, Dr. Carl Bell, Asa Hilliard, and there's some very key messages that we've learned through these ancestors and mentors.
The highest priority that I have for the rest of my life is intergenerational cultural transmission. That we pass on our values, beliefs, behaviors to our children. And that is probably the most serious task that we perform.
We need to teach what is now being labeled as resilience training, giving these young people some of the strengths and skills that they will need to face what we know that they may have to face.
Dr. Bell, who was amazing out of Chicago, worked a lot with CDC. He really focused on the fact that, you know, in many cases, young people are exposed to what they call risk factors, but that there's some very clear protective factors.
Risk factors are not predictive factors because of protective factors.
The risk factors, I hate to say this, are numerous. In public health, they refer to them as the social determinants of health. I refer to them as the social determinants of health disparities because it's these social determinants that create the health disparities that exist in our community. Poverty is the main one, racism. My biggest concern now is the assault on the family. If you continue to break down the family and you continue to break down the village, that's what ultimately is gonna make it hard for young people.
If you live in a country which has a history of not giving you an equal range of choices, and you want an equal range of choices, then you got to improvise. You got to be imaginative, you got to be creative, you got to be innovative.
A lot of the protective factors are just really community. What we refer to as old heads is you have that intergenerational cultural transmission. The first one is social emotional regulation, how to regulate, as that's really the key thing. The second one is wellness practices, mind, body, and soul. The third set, interesting, is having a plan and a plan B, being able to pivot. And the fourth one is navigating systems. The fifth one, getting young people to understand what their rights are. If they're out in the street, if they get stopped, how do they deal with that situation?
The question is, can you get back up after a setback? You're never going to be the same after divorce. You're never going to be the same after violence. You're never going to be the same after death. The question is, can you incorporate that and grow stronger?
Those protective factor skills are really the bedrock of what young people need to go to the next level. And this is what young people and all people actually need through the life cycle to be healthy and to have a level of wellness. Ultimately, to break generational trauma, you're going to need these skills to do that. Then it benefits not only their communities, it benefits all society.
That was Tim Matter reporting. Thank you, Tim. Action News is sharing your story, your voice, your community through the eyes of our talented photographers and community journalists. You can submit your ideas online at 6abc.com/yourstory.